JP Heath from Malmö Seafarers Chaplaincy.
And Mike from Siemens Service in Malmö.
Mike, today we are discussing an issue relating to the seafarers' health.
Yes, the last ship was here actually had a problem. One seafarer had to go to the hospital, and the vessel called the agent, and the agent ordered a taxi for the seafarer from the vessel to the hospital, and thereabout they ended with the service, and it was bad. So, and that is actually not the first time that had happened in Malmö, that the agent only pays for a taxi from the vessel to the hospital, and the seafarer don't know where to go, who to talk to. And it's also a very special situation for seafarers when they come to a new harbor. They don't know who to talk to, and maybe the hospital, because in Malmö it's not so common that seafarers come to the hospital. So it's also a very weird issue when they come to the hospital and they have to say, I have to have service now, because my vessel is leaving. So he maybe only have 2 or 3 hours to spend on the hospital.
Mike, I mean, we've had some experience with this because you and I took the initiative to try and help seafarers get vaccinated.
Yeah.
And that would not have been possible if we had not guided them through the system.
No, because there's a lot of administration, and it's as we were talking about that, it's a so special situation for the seafarers. They don't have the time, and everybody knows that you can wait in hospital for hours and hours just to see a doctor.
Yeah.
And for them the issue is the time, and sometimes they need paperwork that maybe they can't work anymore. They have to go home, and if they don't get the paperwork done, it's off.
So there's a few things that we know for sure. Number one is the seafarers do have medical insurance.
Yes.
So it isn't that there isn't the availability of funds to be able to pay for the care. But the reality that we have, particularly in a country like Sweden, where the healthcare is provided through the state, is that there are not shortcuts or understandings of how you treat people differently without an understanding of what are the circumstances.
Precisely.
And I feel that that's a really important point for us, because when we were taking the seafarers for vaccinations, we went before the vaccinations to the clinic, which was providing the vaccinations, and we said we are coming with seafarers, and these seafarers literally have a few hours ashore.
Yeah, and we, to be frankly, we also had the first 10 times to say this time and again, just because they didn't know how the situation was, because there was another reception, or so even if we knew how the paperwork was doing, we had to go through the procedure again, because of the personnel was.
It took them time to become familiarized with the reality of the seafarers.
Yeah.
And I mean, God forbid, it's not that we're hoping that we will have more seafarers who need the hospital services. It's just that we know that there needs to be an accompaniment program which takes the seafarers through the system.
Yeah.
And then we also need to talk about where are the responsibilities. If a seafarer is needing medical support, we know that the person who is primarily responsible for making sure that support is given is the captain.
Yes.
And the captain has the responsibility of contacting the agent.
Yes.
And then what happens?
Then it's actually the agent who have the responsibility, so the seafarer get the best treatment or the right treatment. And as I told you, this has happened before, and when they just dump a seafarer at the hospital, and he couldn't so good English, so he couldn't make himself understandable, and so it actually took 2 or 3 hours before the priest came to the hospital, find the guy sitting on a bench, and he didn't know what was happening because he hadn't get in contact with anyone and he didn't know who to talk to. So then the really begin the hospital treatment when the priest came and actually took him under his arms, put him through the system, and then it goes through. But it took still just it took I think around 1 hour. And then he had been sitting for 3 hours just waiting
already
because he didn't know where to go, who to talk to.
And let's be frank, most of the time I don't know where to go.
No.
And so it's not as if we're the great experts.
No.
But it's because we have an acknowledgement that this is a complicated system.
Yes.
So I think that what we need to talk about is an accompaniment that can happen. And it's possible that we can discuss here in Malmö how we can have retired doctors or nurses who might be willing to accompany the seafarers through the process, if that is needed. But it is clear that after the captain has phoned the agent, that's not where the responsibility stops.
No.
Because the seafarers are a very vulnerable group and they need to find the healthcare that they need. And even though there is the insurance that ensures that they do get the healthcare, unless you have an accompaniment program, they are going to be stuck.
Yeah, and it is complicated. And for a normal Swede going to the hospital, we also know that you have to sit for a few hours before you get in to see a nurse or a doctor. So, but the seafarers don't have that time, and it's hard to maybe in English to acknowledge that situation for the seafarers. And just about with the vaccination, we had to talk to them time after time after time, just to acknowledge they don't have the time. Yeah, but we have the system, and everything. Yeah, we understand there is a system, but you have to do something about the system because the seafarers are a prioritized group for vaccination, and they have to go in front of the line.
And so if you are watching this little recording of ours today and you are on a ship, we want you to know, number one, that your health is a priority and that you need to see it as such. And number two, that you have protections. The first protection that you have is that you do have health insurance, and the second is that according to the legislation around this, the captain must take a responsibility for making sure that you get the healthcare that you need, and that it needs to be done through the ship's agent. But also understand that where you have a seamen's church or a seamen's club in the harbour where you are, contact us and we can try and help ease your way through the system. Bless you all. Stay safe. Stay healthy.
Bye.